best time to start your retirement benefits from Social Security? Is it 62, 65, 67? And this is completely live. We're recording it live. So if you're watching it live right now, go ahead and put your questions, because I'm going to talk about the best time for you to start your Social Security benefits. Should take about 10 or 15 minutes. And then I'm going to open it up and I'm going to answer any questions you have for the next hour or so. So if any questions you have on disability, survivor benefits, spouse benefits, Medicare, Medicaid, go ahead and put it in the chat there and I will get to it. If you're watching this and recorded, then you missed the live, but just go ahead and subscribe and like, and that way next time we go live, if you've got any questions, you can ask them at that time. Okay, so let's go ahead and get right into it. Let me get everything all set up here and make sure you put your stuff in there. And number one thing is congratulations. You made it this far. We've all made it this far. Every day above ground is a good day. You've probably heard, because what I'm saying congratulations is you've beaten the national average. You hear all the time that the Social Security national average life expectancy is for a male 73 years old, for a female is 79 years old. That is the average, the entire country, everybody. So that goes from 0 to all the way to the end. So the national average. So that doesn't apply to you anymore. You just completely throw that out. Congratulations, you've beaten the national average. Because if you are, let's say you're 62 years old, now your mortality rate, the life expectancy for a 62-year-old in the United States is 81 years old. So you've already beaten the national average. So congratulations there. So this for a male. For a female, it's 84 years old. So if you're 62, you're going to be around for at least another 22 years. So that's a beautiful thing. Again, if you're healthy and everything. If you're 65 right now, you're looking about, it increases about a year. So up until 82 years old. Again, these are national, bases based on those particular age groups. And if you're a female, if you're 65 right now, you're looking at another 20 years or so. So these are good numbers, and now your job is to go out there and beat those averages again. You've already beaten the big one. You've made it this far. So now it's your job to go out there and make sure you kill those ones as well. They're not going to be relevant to you because you're going to go to at least 120. All right, so for all of this, there are thousands of videos and articles and on social media and websites and everything talking about when you should start your Social Security benefit. Should you start at 62, 65? And I've helped hundreds of thousands of people out with retirement benefits. I ran the third busiest Social Security office in the country. If you're new to my channel, I've taken hundreds of thousands of retirement claims, survivor claims, spouse benefits. So I've been there at the time people have made the decision. And I want to go through some of their ideas, some of their thought process on exactly when they decided to go ahead and start benefits. And the number one thing is to understand that these are all 100% guesstimates. You do not know. If you know this, if you know your DOD, as Social Security Administration calls it, is your date of death. If you know your date of death, then you know exactly when to start. 62, 65, 67, you just, okay, I'm going to die this particular year in 2050. And you can immediately say, okay, I'm definitely going to wait till 70 if I die at 2050. So because you don't know that, then all of these are just completely guesstimates, and you just do the best you possibly can. You can do all the long division. There's a bunch of, I've included a calculator in there. So for those who like doing the long division and very mathematically inclined, you can do all the calculations, but unless you know your date of death, it's all just guesstimates. Okay. All right. So when I talk about retire, what I'm talking about, people say, well, I'm not retiring. Well, we're talking about Social Security here, and for Social Security, retiring is starting your benefit. So this is what we're talking about, because you can still work and receive your benefits. If you're, early retirement, 62, you can work and start your Social Security benefits. If you're full retirement age, same thing. And we'll talk about the annual earnings limit here in a little bit. And one thing I want to talk about, I always try to add things that nobody else has added. This is not only for you. So when you should start your retirement benefits, it's not only when you should start your retirement benefits. That is, obviously, but when you start your retirement benefits also affects those other people around you. So if you take your benefits at 62 and you're married or even divorced spouses, their benefit amount, survivor benefits from you, will be reduced because you took your benefit early. If you wait until 70 and get your delayed retirement credits, surviving spouses receive those delayed retirement credits. Current spouses, a lot of people miss this. Current spouses do not receive delayed retirement credits. I mean, living, if you're currently living. But when you pass away, surviving spouses do receive those delayed retirement credits. And you get those delayed retirement credits by waiting to collect your benefits after your full retirement age, 8% per year up until the age of 70. So that is one thing you need to take into consideration. If you have a spouse and you want to take care of him or her, it might be a good idea to think about that, of what happens if one of them passes away, how much will the other person be left with. So it's not only about break-even analysis and long division about this, that, and future projections. It's also about that. And also children. If you're saying, well, I'm 62 years old, but I want to go ahead and wait till my full retirement age, or 65, or whatever the case may be, but you've got one or two children that are under the age of 18 or that became disabled before the age of 22, they can get benefits as well. So, but they can't get benefits until you file. So sure, you're going to be losing $100, $200, $300 a month by filing early at 62. But if you have a child, disabled adult child, or a child under 18, they can get benefits, 50% of your PIA, your primary insurance amount, what your benefit amount would be at your full retirement age. So you have to take that into consideration. So you're sure you're losing 300, but you're getting 700 for the children. So that's another consideration. Okay, but let's go back to yours. So if you are going to retire early, if you're thinking about retiring early, the number one thing you have to understand is there's a limit, an annual earnings limit, that anything over this year, 2024, anything over $22,320, Social Security holds back $1 for every $2 you go over. So if you make $1,000 over that, then Social Security is going to hold back $500. So you have to take that into consideration. And not necessarily the first year. In the first year, if you go $22,320 over the first year, it's not a big deal. You can make $1 million up until you start your benefits. If you want to start your benefits in July and you make $1 million from January till June, no problem. As long as you stay under the monthly limit in July, starting July, that's $1,860. As long as you're under that monthly limit starting when you start your benefits, you're good. And next year you have to stay under the yearly limit, or they're going to hold back $1 for every $2 you go over. Okay. So, and then once you hit your full retirement age year, the year you turn your full retirement age, then you can make $59,520 for the months before your full retirement age. And then once you hit your full retirement age, you can go back to making $1 million a month, no problem whatsoever. All right. So what if you decide to go ahead and take your early retirement at 62, 63, and then you change your mind later? No problem. A lot of times, if you do something with Social Security and you make a decision, you make the wrong decision to begin with, Social Security, I know, is not forgiving. You might be stuck at that benefit amount for the rest of your life. But this is one where you can kind of get a mulligan. That, let's say if you go ahead and you retire at 62, or you start your Social Security benefits at 62, and then, I'm going to retire. And then, like I did, I retired for about 10 days and I started doing this crazy stuff. So after a year, You can say, well, retirement's not for me. I want to go ahead and find a job or go back to work, or whatever the case may be. As long as you're under the 22,000, you're good. But if it looks like you're going to be over that, all you have to do is call Social Security and say, yeah, the whole retirement thing wasn't for me. Go ahead and suspend my benefits. If you do it within a year, you can actually completely cancel your application, but you have to pay everything back. So if you don't want to do that, that's fine. If you just want to suspend your benefits, say, hey, I decided to go back to work. I'm going to make way over 22,000. Just go ahead and suspend my benefits, and they will suspend your benefits. And you'll say, well, I'll lose that. Well, not necessarily. How it works, if you go ahead and get like a 30-month reduction, you get your benefits 30 months before your full retirement age, your benefits are reduced 30 months. Every month you take your benefits earlier, they're reduced. And then let's say you go back to work after 10 months. So you only took 10 checks. So once you hit your full retirement age, the Social Security's computer looks at it and says, okay, you took a 30-month reduction, so your benefit was down here, but you only took 10 of those. So we're going to give you those 20 months back in your calculation for the rest of your life. So you're only going to get a 10-month reduction. So again, at your full retirement age, you can decide to turn it on at that time, or you can say, no, I want to go ahead and do the delayed retirement credits because I know my date of death is going to be 2070. Yeah. So hopefully they come out with some longevity pill like that. Hopefully there's a male pattern baldness one before that one, but here. Well, I'll take both. All right. Another thing is, if you are going to take early retirement because you're unable to work because of a disability, I point this out all the time because there's so many people that lost money because of this. You can file for retirement and disability at the same time. You can't receive both of those checks. You can't receive, 2,000 retirement through 2,000 disability. You get either one. But you can file for retirement benefits, start your money, get your money coming in if you need money now, because to get a disability claim approved takes 6-9 months if you're lucky. So a lot of people say, well, I'd like to file for disability, but I can't wait for 6 months. I need money now. So you can file for retirement, start your money, and file for disability at the same time and wait while you're disability. And if you're going to do that, make sure you watch my videos on filing for disability, all the tips, tricks, and secrets. All right. So the break-even point, you can definitely, knock yourself out and do all the calculations. I put there's lots of calculators. I put one, I think there's a couple of other ones I'll throw up there as well. So you can go in and says, okay, if I go ahead and do it at 62, you'll need to know your PIA, which is your primary insurance amount. So just go into socialsecurity.gov, set up an online account, and please do that anyway. Because if you haven't set one up, it prevents someone else from going in there and pretending to be you. So you go in there and set up an account, you put in your name and your email and all your phone number and all that kind of good stuff. And that way later, if somebody goes in there, pretends to be you somewhere in the world, pretends to be you, you'll be notified. So that protects you a little bit more. And yes, it's a nightmare to set up the online account. Social Security makes it difficult for a reason. So other people can't pretend to be you and go in there and set one up. So please set one up. And when you do, go in there and check your work earnings, your history of earnings, because that's how everything is determined. That's how it's determined how much you're going to get when you file for retirement or, survivors or spouse or disability. It's based on your work history. And if your work history is wrong, you're going to get the wrong benefit for the rest of your life. So go in there and check out your earnings, make sure everything is correct. And you can do your break-even analysis based on that PIA, the primary insurance amount, your benefit at your full retirement age. All right, so that is everything about, again, nobody can really tell you. There's just too many variables. Your health, the longevity in your family. If, mostly people in your family live to, 80 or 100 years old, then it might, pay to delay. But if you need the money now and you're tired of working, you can't work anymore, then you need the money now. You want to go out and travel and have fun. You read my YouTube comments and everybody, I think probably about 80% of the people say, yeah, take it at 62 and enjoy your life. So there's a lot of people that just take it at 62 and do that. But remember, your Medicare won't start until you're 65. So you need to come up with, if you're going to take 62 because you're going to stop working, you stop receiving health insurance from work, then you got those 3 years without health insurance. So you go on the Affordable Care Act, Marketplace Insurance, Obamacare, whatever you want to call it, and get that until your Medicare starts at 65 years old. All right, I think that is it. So if you're just here for that part of the today's topic, then have a beautiful day. Make sure you subscribe and like and all that kind of good stuff. But everybody else that has questions, I'm going to stick around here for about 45 minutes or so and answer as many questions as I possibly can in the time we have together. All right, let's see what we got here. Megan, hello, Dr. Ed. Looking forward to learning from you, and thank you. You're welcome. Welcome. Oh, we got a support super chats. Mike and Kathy, $85, $1.99. Thanks, I appreciate it. Thank you. Yeah, supporting the channel, appreciate it. All right, Kim, I am anticipating an official overpayment letter, so I received a letter that several years shouldn't have been paid. It could be 90,000. Wow. Should I file bankruptcy, as I doubt that will be waived? Yeah. Bankruptcy and a Social Security federal debt like that, yeah, that's going to be very, very difficult. All right, so they just changed the laws, or just changed the regulation on overpayments. So number one thing I would do, if you've already received a letter, then it'll give you appeal rights in that letter. So if that's the initial decision, what you can do is submit an SSA 561, which is a request for reconsideration, and submit that. And the request for reconsideration only has, 2 or 3 lines where you can put stuff in there. So you can add another piece of paper and just put, see attached, and then give them your story, type it out or whatever and attach it to it. Submit it to the Social Security Administration and say, no, I think you're completely wrong because of this, that, the other, whatever the case may be. And someone else in the office who didn't make the first decision will look at it again to see if it's correct. And then if that is denied, then you can go to the administrative law judge. You do a SSA 501 and you request an appeal with an ALJ, administrative law judge. An administrative law judge has a lot more latitude, a lot more freedom to kind of read between the lines of the strict, 20,000 plus pages of Social Security policy. So I've seen a lot of, administrative law judges that have waived stuff, and I'm like, wow, that's okay, whatever. So yeah, that's the procedures I would go with. And like I said, they just changed the law. But if you got $90,000, they just changed the law where a few weeks ago, where if you had an overpayment, they would immediately hold 100% if you didn't contact them. And you can only do like a 12 months or 24 months if you got supervisor approval. But now it's 60 months. So you can immediately set up a payment plan for 60 months but if you got 90,000, that's not going to be relevant. So I would definitely have someone else check to make sure that overpayment is in fact correct. Maybe they forgot to carry the one and actually you owe 9,000 versus 90,000, whatever the case may be. So yeah, let us know how that goes. Don Ricky, my wife took her Social Security age 62. I'm waiting till I reach FRA in 4 years. If I die before I take Social Security, can she take the survivor benefits or half of mine, which would be higher? Okay, so yeah, for survivor benefits, she would, if she's her full retirement age when that happens, and you haven't collected benefits, then she will receive 100% of your full benefit amount, your PIA at full retirement age. Yeah, so survivors get 100%, up to 100%. That's why I said if you take your benefits early at 62, the max the survivor can get is actually 82.5%. So that is a important consideration. But remember, if she's 62 and her benefit amount is less than half of yours, then she can file for spouse benefits. Once you file, you have to file first. So they changed that law in 2016. All right, Vogel Jennifer, hey, what's up? I am 53, still working, but completely deaf except for hearing aid in one ear. I've had a stroke 4 years ago. I'm trying to keep working for 3 more years. What should I know? All right. So let's see. You're currently, yeah. If it sounds like you're just trying to, get through it and work as long as you can. But if it ever turns out that you're just not able to work because of your disabilities, then please, please, please file for disability. um, you have to essentially stop working or earn under, this year it's $1,550, $1,550. So the first month you earn under that amount, then you can file for disability. And even if it's if it's $100, $200 over, they have what's called IRWEs, impairment related work expenses, where if you have particular work expenses that you have to incur because of your disability. So there's a little wiggle room there. As my regular viewers know, there's exceptions to the exceptions to the exceptions on anything Social Security. So yeah, just it sounds like you're persevering, but if ever turns out you can't, please file for disability and watch my videos. I did was it 3 or 4 videos within the last few weeks on tips, tricks, and secrets on filing for disability. All right, X Courage. Hello, turning 65 in December, working full time, 21 current employees, which drops below 20 employees often. I live in Massachusetts. Thank you. Yeah, that's okay. So you are talking about the health insurance, whether you can stop, whether you can not sign up for Part B, because when you're 65, you have to sign up for Part A and Part B, unless you have insurance through current work and your employer has 20 or more employees. But yeah, if it goes up and down, what happens is the deal with that is if it's below 20, then your insurance company makes you sign up for Medicare, because Medicare becomes the first payer. So that's more of an insurance company thing to protect you. So I would, to make a final analysis on that, you'd have to reach out to your insurance company and says, okay, I'm going to be 65 coming up pretty soon. Reach out to the, HR or whatever the case may be, the boss, and find out what your insurance company says about that. I'm going to be turning 65. Do I have to sign up for Part B because the employees go up to 20, 19, 21 or something like that? And they'll say, yeah, in your particular category, we're going to make Medicare the first payer. So if you don't sign up, you're going to be on the hook. But if they say, oh, no, you're, for, half of the year plus 1 day, you're 21 employees, so you're good. So I would ask the insurance company, just to be on the safe side. But yeah, if you have to sign up for Part B, then you sign up for Part A, Part B. The Part B is $174.70, and then you have to start figuring out, what type of coverage you're going to get to cover the gaps, Medicare Supplement or Medicare Advantage plan. And as you can see, I've tired of Medicare insurance agents telling people the wrong thing, so I decided to put together my own little network across the country. So if you don't have someone to help you out, contact us, contact me, send me an email, and we'll put you in contact with someone that's good. Rose, if you have an overpayment, can you pay it in 1 month? They send you the notice. Yeah. Actually, that's what Social Security does. As soon as you have an overpayment, they say, okay, you owe us, $1,000. Here's an envelope. Send us a check. Pay it immediately. Pretty much, almost a majority of people don't pay it immediately. They set up some type of payment plan. But yeah, absolutely. You can pay it off in one lump sum. Yes, absolutely. And that's what some people do. If they have, if they're 62, 63 and they've got the annual earnings limit they have to deal with, and they're like, well, it looks like I'm going to make $1,000 too much this year, or $2,000 too much this year. Should I call up Social Security and suspend my benefits? You can, but I can tell you, working inside the bureaucratic beast for a couple of decades, the Social Security computer system is wanting. If you suspend your benefits, it might take them a month or two, and it might not even serve the purpose. And then it takes forever for them to turn it back on, and it's just sometimes it turns into a nightmare. If you're just going to be a little bit over, what a lot of people do is they say, okay, I'm going to be, I'm going to make $2,000 too much. So I'm going to owe the Social Security Administration $1,000. So once you get a check, put that $1,000 in the bank, collect a little interest. And then when Social Security sends you that nasty gram next year in, January, February, March, April, whenever, after you file your taxes, you tell the IRS how much you make. IRS tells Social Security how much you made. Social Security says you owe us $1,000, send you the letter, and then you can do what Rose talked about. You just go ahead and send $1,000 in. No harm, no foul. And it doesn't affect anything. Well, it does affect anything, because if you were overpaid for a month or two, you weren't entitled to that month or two. And then once you hit your full retirement age, that month or two is put back into your benefit amount. So when you hit your full retirement age, your benefit amount increases. I get calls like that all the time. Yeah, I just hit my full retirement age and they increased my benefit amount. That's because sometime in the last 4 or 5 years, you didn't get your check because you weren't over. And they're, oh yeah, that's right. 3 years ago, I stopped working for I started work for 6 months and I stopped my checks. Oh, there you go. They put it back in. That's completely automatic. All right. Elizabeth, thanks for doing this. You're welcome. I have a question. I'm currently 61, federal employee retiree. I currently receive FERS supplement, which ends in February 2025. I turned 62 in March, part 1. Oh gosh. Let's see if I can find part 2 here. I want to start working full time starting in January 2025. Is there anything I need to worry about if I decide to take Social Security later? Yeah, if you're working while you get the supplement, the first supplement, then you have to notify OPM. It's a nightmare to stop that. It's a nightmare to stop it. But yeah, again, same type of thing. If you earn over the annual earnings limit, you are going to have to pay back $1 for every $2 you go over. Same exact thing when you get the first supplement, prior to 62. I think it's easier to suspend your benefits with Social Security than it is with OPM. But yeah, anyway. Let's see. Can I take spousal benefits at 62 and then switch to my own benefits at FRA? No. Unless those spousal benefits are surviving spouse benefits. You can take survivor benefits first and then switch on to your own later. But if that person is still out there alive and kicking, no. You have to file a claim on your own record. And then if your spouse's benefit amount is twice as much as yours, then you can file a spouse claim. And when I say twice as much, I'm talking about the PIA, the full benefit amount, not how much you're receiving right now, or how much, plug my thing back in here, or how much that person is receiving right now. It's based on the PIA, the primary insurance amount, the amount at the full retirement age. So don't look at your check and look at their check and, hey, is yours twice as much? No, don't. Call Social Security and they'll tell you whether there's any money there. And if there's any money available in spouse benefits, then they'll schedule you an appointment if you want to go ahead and get them started. All right, let's see. Rose has got a follow-up here. If you have an overpayment, can you, oh, okay, I've already answered that one. Let's see here. Okay. I'm collecting spousal Social Security benefits, and I will collect Canada's CPP similar to the U.S. Social Security system. If I collect the Canadian payment, will my spousal benefit amount be reduced? Normally not on spouse benefits, but there's that's a totalization agreement. Social Security has agreements with dozens of hundreds of countries out there that they recognize this and they don't recognize this other thing. So yeah, it's I think Canada, there's a 2-tier system in Canada. One it recognizes and the other it doesn't. So yeah, it really depends how the totalization agreement is written for that particular country. I believe we should report those fake Social Security clickbait pages that promise $2,000 Social Security payment this month. What do you think? I agree 100%. I did a video on that that few days ago. It's My wife harassed me a little bit because I was playing around with unicorns and ice cream. So if you see it's a cute little, magical thumbnail, purple with unicorns and ice cream. And I'm like, yeah, all these companies, all these, Facebook pages and YouTubers and TikTokers promising you free ice cream and unicorns for life. And once you click on it, then they got you. They've made their money. So yeah, it's all of that stuff. As I talk about, is most of it is politicians that are just trying to pander for votes. So you have some, local or the House of Representatives, federal representatives saying, okay, hey, I'm going to give you all free ice cream and, unicorns for life. Vote for me. And, people get suckered in, vote for the person, and they say, oh, yeah, that's never going to happen. So same type of thing. Yeah, it's unfortunate. Unfortunate. It's a waste of time. And as I mentioned, they're doing a disservice too. Thank you. Yeah, you're welcome. Is because when I worked at Social Security Administration, we used to get calls all the time for people saying, "Whoa, where's my $2,000 check?" And that takes away from resources where there's other people actually having good questions that, hey, where's my check and when are my benefits going to start and I need to set up an appointment. All those important calls are being delayed because we're having to deal with, yeah, people clickbait garbage. Yeah. So anyway, all right, there's my 2 cents. Well, yeah, my husband is in his first year of Medicare. We are already in the donut hole. We are on an Advantage plan. Any suggestions how to pay for the meds? Not really understanding the dastardly donut hole. Yeah, they actually stopped calling it a donut hole because it's kind of changed last year, and it changed again this year. The max you can pay is $8,000 in catastrophic, and next year I'm going to do a video here on changes for 2024 and 2025 going forward. But one of the big ones is next year, the max catastrophic you can pay is $2,000. Um, so that's going to make a big changes in everything. So yeah, watch out for my video coming up here. I'll probably do it within the next 3 or 4 days. But there is, if I would apply for, it's called extra help, or LIS, low income subsidy. Again, it's, if you qualify for it, if you're having difficulty paying your medications, call Social Security, the 800 number, 800-772-1213, and tell them you want to file for extra help with your prescription drugs. And it's one of the easiest applications in Social Security to do. They take the application, and if they approve you, there is estimates that it saves people $5,300 a year. That was last year, but now that's because it's $8,000, it's limited. So, but it'll save you. Yeah, it should save you a lot of money. So it's called extra help with your prescription drugs. So please call them up and get that application. But also, another thing to do is, because those Medicare Advantage plans change every single year, you might have been good last year with your current plan, but the plans change every single year. So you have to keep up on those. I just did a video a couple of days ago about that. You'll see it on the thing. It's Medicare Supplement has one button, on and off. Medicare Advantage has 20 or 30 different buttons that you have to keep up on a regular basis. And that's one of them. You have to make sure your doctors are still in network and your prescriptions are still covered. And, they didn't, usually they kind of raise your out-of-pocket expenses on stuff you don't really notice until you notice it. And then one day you walk into a hospital after an accident or something, and they say, wait a second, I have to pay that much money for that? It's like, when I signed up for this plan, it didn't have that. Well, it's because they change it every single year. People always say, I've had the same plan for 2 years. No, you haven't. You've had that plan since January 1st. They change every single year. So you have to keep up on them every single year. Again, that's Medicare Advantage. Medicare Supplement, once you sign up, you're done. So unless you want to switch from a G to an N or something to save yourself some money. But yeah, if you have a Medicare agent, reach out to them, have them go through it. If not, give us a call, email me, give me your name, phone number, the state you're in. They're all state specific, and tell me what you need, and I'll find someone to help you out. Elizabeth, thank you. And thank you. I can't read. something tree. I could read Japanese, but that's Chinese, so I can't read that one. Joe, thank you. You're welcome. Lisa, are the quotes on the quotes on the SSA.gov for SSN? The quotes on. Oh yeah, so the quotes in terms of the estimates of your future benefit amount. Yeah, the estimates on SSA.gov when you set up your your My Social Security. Those are those are estimates based on future projections, your work, and all the rest of it. So. Oh, okay, yeah, there we go. Yeah, are the quotes on the SocialSecurity.gov website accurate? Yeah, so one of the things is you look at your estimate online at 55 years old, and it says, okay, when you reach 62 years old, you're going to get this amount of money. But when you looked at it at 55, what the computer did is they estimate going forward. Okay, last year you made 50,000, the year before you made about the same. So they say, okay, for up until 62, you're probably going to make about $50,000 every year. So here's your benefit for 62. But if at 55, you immediately see how much it is for 62, and then you stop working for the next 7 years, then that benefit is going to be incorrect. So, Lisa, I am now blind in my left eye and partial vision in my right. I had a tumor removed in my head. Wow. Working from home, but had hard daily to see the monitors. How hard would it be to get disability? Yeah, disability is always hard to get, but it is possible. One of the thing I think lawyers out there do is, they try to do all the scare tactics about everybody's being denied the first time and stuff like that. And I've taken hundreds of thousands of disability claims, and I know people aren't denied the first time automatically like that. Um, you know, Mental issues are difficult, back issues are difficult, but yeah, I've had thousands of claims that were approved the same day, the next day. So yeah, if you can just no longer work because of your disability, then absolutely, please file for benefits. And again, watch my 4 videos on filing. It gives you tips, tricks, and secrets, and medical records, and how to make a good case for yourself. So yeah, thank you. You're welcome, Mama Deb. All right. Started early retirement benefits January 2024. Still working, but having physical difficulties and afraid I might have to quit totally. Can I still apply for disability if I have to quit? Absolutely. Absolutely. Yes. If you're still under your full retirement age, because once you hit your full retirement age, so Mama Deb, I like saying that, Mama Deb. If you go ahead and file for disability, let's say you're 63 years old right now, you get approved for disability. Once you hit your full retirement age, your disability benefits are switched to retirement benefits anyway. It's the same. Nobody really notices because it's the same check amount. You get it on the same day. So yes, but immediately once you're no longer able to work, and that's the important thing is, if you're still working, because I know it's tough, you're still working and because you need the money, but you're just pushing yourself too much, and you go at a Social Security and you file for disability, and you say, and the first question they're asked is, are you currently working? And if you say yes, and you're making over $1,550, then they're going to immediately deny you. So unfortunately, you have to actually stop working or go back to part-time. So maybe your employer can, knock you back to part-time. You stay under the 1550. That way you can make a little bit of money while you're waiting for your disability. But you're also, you're also receiving retirement benefits too. So that's 51, 51, 50. Somebody's birthday, perhaps 51. All right, let me show some love to TikTok here, even though TikTok doesn't love me because I say bad words like death and stuff like that. How much can I make now that I'm 66 and a half on Social Security? So it depends what your full retirement age, but if that is your full retirement age, 66 and a half, then you can make, let's say, $1 billion a month. Is that good? You have my permission to make $1 billion a month. So yeah, once you hit your full retirement age, you can make all the money in the world. doesn't affect Social Security at all. So it actually, even after your full retirement age, if because you still have to pay FICA, you have to pay FICA forever, um, unless you work for some state, local, city government that doesn't pay FICA, but that's only 4 or 5% of the population. But yeah, you pay FICA forever, and if it's one of your high 35 years, because that's how Social Security is determined, by your high 35 years of earnings. So if you're 80 years old and made a lot of money last year, then Social Security will look at that and say, oh, that's a high 35 years. They kick out the low one, put in the new one, recalculate, give you extra money. So, but yeah, you don't have a earnings limit anymore. Let's see, is taking survivor benefits at 65 a good age to file? Then at your own age, switch to your own. Yeah, it really depends. It completely your decision based on your particular situation. But yeah, that's a strategy that's a lot of people use. Is, again, if you file for survivor benefits, you can start survivor benefit 60. The earliest you can do is 60. So if you're going to go survivor benefits at 65 and not touch your own and let your own increase, then that's what a lot of people do if they're able to do that. So they collect the survivor benefits and then let their own benefits on their own record increase till 67 or 70. And then they switch from survivor benefits to their own record. And so you make so much more money. I receive SSI. My question is, can I work? Yes, you can work. But SSI, because it's a needs-based, welfare-based program, then any type of income coming into your house will offset your SSI benefits. So yes, you can definitely 100% work, but you have to understand, you have to make sure you report any earnings you have, and whoever the claims specialist at your local office, kind of keep them up to date, to avoid all the overpayments. I am going to do a video within the next, I think, is it the one I do tomorrow? I think it might be the one tomorrow on how to avoid overpayments. What do you recommend for primary earner retiring at 65 and spouse has no insurance for 1 year? Yeah, the Affordable Care Act, Marketplace, Obamacare. That's what most people do. Or there's short-term medical as well. I think the government is kind of phasing out the short-term medical. Not yet, but looks like it might be in the future. Yeah, the Affordable Care Act. So I'm probably going to start setting up a network of people to do that as well, because I'm just, again, working inside the bureaucratic beast. I saw the result of so many people giving out incorrect information, but I couldn't say anything because I was a federal employee and I can't say anything about private stuff like that. But I'm like, yeah, when I can speak my mind, I'm gonna speak my mind. So that's why I said, all right, all these Medicare insurance agents telling people the wrong thing and messing people up, and I'm like, I'm gonna put together a team that does the right thing and takes care of people, and so that's what I'm doing. And then same thing with burial insurance. I've set up a team for that. And I think I'm going to do one for the Affordable Care Act too, because a lot of people are doing the wrong. They're switching people without even knowing it. The government's finally come down on that in the last few months, but yeah, the agents are going into people's records and switching them from one plan to another. And come on, people, do the right thing. All right, how much can you make working after applying for SSI? So again, that's the welfare. SSI is the welfare-based benefit. So, you can make as much as you want, but if you make $1,000, then you're not going to receive SSI anymore, because the max you can get from SSI is $943. So hopefully you meant SSI as an SSI. A lot of people say SSI, but they mean regular retirement benefits, whatever. All right, so once I retire and die, can my kids collect survivor benefits of what's left? Yeah, that's not on a what's left type thing. Yeah, if they're under 18 years old or became disabled before the age of 22, yes, they can collect 75% of your benefit amount, up to 75% if there's more than one or two kids on there, there's a family max that can be paid out. Absolutely, absolutely. Let's see. Also, if I'm on disability before collecting SSI, will my check increase with SSI or stay the same? All right. So if you're on disability and your disability amount is under $943, then you might be eligible for SSI, which is the welfare-based benefit. But SSI only pays $943 this year. So people can get SSDI, the disability insurance you paid for FICA, and SSI, the welfare-based benefit. So if your SSDI is only $500, then what they can do, they can pay you some SSI as well, $443 for a total of $943. So that's how that works. So there's a lot of people that are on SSI and SSDI, just as there's a lot of people on Medicare and Medicaid. So millions of people are on Medicare and Medicaid. So let me having battery problems all around here. Okay. This is 100% live. You can tell, right? All right. Let's see here. Maria, what's up, Maria? If a working spouse dies and had disabled children and their surviving wife files, how will that be calculated? How will they split the amount accumulated date filed to date approved? Okay, so if you have, so children is plural, so it really depends on the family max on that particular person's record, the deceased, the person that passed away. So the children can get up to 75% of the parents' primary insurance amount, again, how much they would receive at their full retirement age. But there's a family max. There's a maximum that can be paid out. And the quickest way to figure it out is just call Social Security and say, what's the F max, the family max? And they'll tell you it takes 2 seconds. And they say, okay, there's only $3,000 to be paid out. So, one child might get 1,500 and the other might get 1,500. But if you, being the mother, are not working, or working under the annual earnings limit, you can get what's called surviving child in care. You can also get up to 75%, but it might reduce the other ones. So the total might be the same. One child gets 1,000, the other one gets 1,000, you get 1,000, still $3,000. So yeah, it really depends on the family max. Let's see, Mama Deb, a medical leave of absence will allow you to get benefits from your job versus quitting if you're eligible. Oh, thanks, Savannah. Yes. Yeah. But yeah, it might be a Cobra type thing. Cobra is just, the intent of Cobra was good, but it's just crazy expensive. Crazy expensive. Is it true illegal aliens can collect any type of Social Security? It's hard to believe this is true. Yeah, no, it's not true. I've taken hundreds of thousands of claims. My office, again, the third busiest in the country, we've taken millions of claims. And if you come in and file for, retirement survivor benefits, whatever the case may be, you have to prove you're in the country legally. We need, U.S. citizenship, and if your Social Security number when you originally got it when you were 7 years old or 1 year old, U.S. city that you were born in, then that's proof of citizenship. But if you were born overseas, we need to see your certificate of naturalization. We need to see your green card. If we get any of those two, we have to run it through the system with a G845 form. I still remember these crazy forms. And we have to confirm through the INS that, yes, it is a correct, a valid document. So, no. But there are, on the reverse side of that, I talked about this yesterday, there are a lot of people that are, not in the country legally, and they, went down to the local swap meet and got a Social Security card, a Social Security number, and they gave it to their boss, and their boss didn't do the right thing because their boss needed employees. So they just say, yeah, whatever. Okay. They didn't check. They're supposed to check it through the system, but they wanted the employees, so they didn't care. And they paid this person their pay, and they took out FICA taxes, and that FICA taxes went to the trust fund, and that person, unless they become naturalized later, become legal later, get legal documentation later, they're never going to get that money back. So billions of dollars go to the trust fund from people working illegally in the country. So thank you very much for the donation. We appreciate it. Miss Lady T, I will be retiring at 60 in September of this year. Can you continue to get my own SSI and file for spouse support after 10 years of marriage? Okay, so if you're receiving SSI, the welfare-based benefit, then you definitely have to file for any other benefits available to you. So if you don't, then yeah, they could stop your SSI. There's kind of good and bad in that. And so it forces people to take their benefits early at 60 or 62 and reduce for the rest of their life, but then they receive the SSI. So anyway, yeah, it depends on how much your spouse benefits are. If it's over $943, I think there's like a $20 wiggle room in there, then yeah, your SSI will stop. So, but yeah, so yeah, the SSI. So I would definitely contact them. But I was going to add on there, if you receive an SSI, in most states you're categorically eligible for Medicaid. So if you're receiving Medicaid, you might be paranoid that your Medicaid might stop. But usually states take that into consideration, that your benefits, your SSI stopped because you got survivor benefits, so they might actually continue your Medicaid. So, but yeah, you need to check them all out. Are Medicare Advantage plans ever advantageous to a patient with chronic illnesses? Yeah, I mean, versus the alternative of having to pay 20%. If you have $100,000, chemotherapy or something like that, yeah, and rather than paying $20,000 out of your pocket, you might, depend on your Medicare Advantage. Your Medicare Advantage plan might have a maximum out of pocket of $2,000 or something. So rather than $20,000, you pay $2,000. So yeah, I think that's a pretty good advantage. But I know where you're going here. The pre-authorizations. If you have something that costs $100,000, will the insurance company harass you and say, instead of going to have that necessarily surgery that the doctor thinks, says you need, have you tried walking it off? As yeah, we used to say in the Marine Corps, it's like, yeah, I broke my leg. Well, have you tried walking it off? So yeah, the pre-authorizations, yeah, I know where you're going here. That's an issue. That's why I always recommend Medicare Medicare supplement plans, a G or an N, because you don't have to deal with the insurance companies. You get an insurance company to give you that G or an N, but they get no say whatsoever. If your doctor says you need it, you want to do it, and it's covered by Medicare, you're done. So you don't have to ask an insurance company for permission to do X, Y, or Z. Let's see. New to Medicare, original Medicare Part A and Part B. Is D required? Yes. Yes. To avoid penalty? Yes. That's one of the reasons, one of the hundreds of reasons I decided to put together my own Medicare team across the country, is too many people are paying penalties for the rest of their life on Part D because Medicare agents aren't telling them that, because the person says, oh, I don't need a prescription drug plan because I don't take drugs. And the Medicare agent doesn't, a lot of times doesn't make any money selling the prescription drug plan. So they say, oh, okay, I don't want to fight with you, and I've got other people to talk to. So, okay, yeah, whatever, bye. And then 2 years later, 3 years later, 4 years later, the person needs drugs and they go and sign up for Part D, and they're penalized 1% for every month they didn't have Part D for the rest of their lives. So yeah, you have to get a prescription drug plan. Yes. Again, you're only penalized if you sign up later. So yeah, what I say, exceptions. So a lot of vets, don't sign up for prescription drug plans. But if they do later, they're penalized. But the reason they don't is because they get all their prescriptions from their VA. And if they're happy with it, and it's usually free-ish from their VA. But if anything happens in the future, they move away, and now the pharmacy's 100 miles away, then they come up and sign up for Part D and say, I'm sorry, you're penalized 120% because you waited 10 years. Then there's that. And a lot of prescription drug plans this year are, super inexpensive, under $10, under $5. But there's a change coming on that one. So that's why I'm doing the video on major changes to Social Security, Medicare, 24, 2025. So make sure you watch out for that video. Subscribe and like and all that kind of good stuff. So, all right, Daryl. Hello, I reach FRA in 4 months. What are my best options? What are we talking about? Let's see here. In terms of money, yeah, when you're a FRA, you can earn $1 million a month and continue to collect Social Security or start your, Social Security benefits, or you can wait until you get the delayed retirement credits. Miss Lady T, Texas. Hey, Texas. I went to high school in Paris, Texas. Yes, we did have Eiffel Tower, and yes, it did have a cowboy hat on top of it. I'm tired of my so-called friends making fun of me because they retired and took Social Security at 62, while I prefer to wait until later to collect. Yeah, but yeah, everybody's different, and there's no situation that's best for everybody. There's so many different variables, and that's the same thing in the Medicare plans is. Oh, my next door neighbor got this plan and they like it. Well, has no relevance to you whatsoever. They might have different doctors, different prescriptions, different needs, different medical things. So do whatever is right for you is right for you. So I signed up for Medicare Part A and B and have TRICARE for life. Are there any supplements I should consider, or am I set? Yeah, a lot of people. Yeah, no, you definitely don't need. Again, it's not again, but Medicare supplements are the ones have the monthly premium. But over the long term, sometimes it costs you, saves you tons of money. But the only thing that some people on TRICARE, and thank you for your service, they get a Medicare Advantage plan. Again, I recommend a Medicare supplement plan. But a Medicare Advantage plan you can get with 0 premium, and you might be able to get some extra benefits. And Medicare, the government allows these programs to do what's called a Medicare Part B give back. And they're usually directed to people like you. They're called Patriot plans or honor plans. And so they're focused on vets that pretty much have all the stuff they need. So you can get one of these Medicare Advantage plans, 0 premium per month. Again, all this depends on your particular area. There's thousands of plans. So 0 premium per month. And depending on your area, they might pay your Part B, $50 of it, $100, or all of it. So you get some extra little benefits and, the opportunity to maybe get a second opinion or something like that. So that's what some people do. So yeah, if you have a Medicare insurance agent or broker, I'd recommend a broker. If you look for an agent, it's like the old Henry Ford thing. You can have any color car you want as long as it's black. So if you get an agent, they only might work for one company. So that's what you're going to get. I only work with brokers. So a broker works for you. They look at all the plans in your area and give you the best recommendation for you. So yeah, give me a call, email me, and I can find someone to help you out if you would like that. Ed, you have 173 watching, the highest I've seen. Oh, Donna's looking out for us. Yeah, thank you. Yeah, awesome. Yeah, we need to get the information out there as much as possible. So many people are losing money. Oh my gosh. Just read the comments and, oh, I didn't know I had this. And so we found millions. Well, y'all have found Donna and Glenda and Daryl, Kent, you have made this available because I can, as I always say, I'm just, just some idiot, sitting in front of camera and telling you all this information, my experience. But it doesn't get to people until y'all subscribe and like and share and stuff like that. So y'all are the ones that are helping people out. So I appreciate you. Let me see. Gizmit Dora Lopez. I qualify for dual benefits based on my income, Medicare and Medicaid. I called Social Security. The CSR told me I must first apply for Medicare Part B. I have Part A, cannot afford Part B. True. I am FRA. Okay, so if you have Medicare and Medicaid, yeah, CSR is a customer service representative, the first line in the Social Security office. So you have Medicare and Medicaid. So yeah, Part B, if you have Medicaid, depending on your level of Medicaid, I would call the Medicaid office and say, hey, sign me up for Part B. And what will happen is the Medicaid office will pay for your Part B premium. It's called a Medicare Savings Program. So call them up, and this is one of the big shortcomings of Social Security and Medicaid. I worked for Social Security for a few decades, and before that, I worked for social services doing Medicaid. And those two computer systems don't talk to each other. So you might get the runaround where you contact Medicaid and you say, go ahead and sign me up. And then they say, we'll call Social Security and tell them first. And Social Security will sell Medicaid. Yeah, it's called a welfare accretion. And you'll might have to get a letter from Medicaid. It's called a welfare accrete letter, and you take it down to Medicare and you take it down to Social Security and they sign it up. But yeah, just be prepared for a bureaucratic, ping pong. But super long story short, Medicaid, if you're qualified, they will pay for your Part B premium. So you'll have Part A, you'll have Part B. You've already got Part D, the prescription drug program as well. You also have the extra help with prescription drugs in there as well from Social Security. And then you can get a Medicare Advantage dual plan. Again, I usually recommend Medicare Supplements, but if you have Medicare and Medicaid, Medicare Advantage dual plan is definitely the way to go for you. So yeah, once that happens, contact your agent or contact us and we'll help you out. Glenda, what form do I fill out to have Social Security do a redo because I don't agree with their calculations, especially now that my ex has filed? Yeah, your ex filing has no relevance to yours at all, because your spouse benefit is based on his PIA, his full benefit amount, not what he's receiving when he filed. So if he received his benefits at 62 or 70, doesn't matter to you at all. It's based on his full benefit amount. So, but SSA 561, a request for reconsideration. The Bike Freak. Is there any alternative yet comparable strategy to the spousal benefit given this has recently expired? No, not really. Yeah, you're talking about the file and suspend that they ended that in 2016. It's just that the last person that based on age that could have used that has can no longer use it. So yeah, that ended a long time ago. One thing that a lot of people miss is the strategy of, again, if you were ever married to anybody that passed away and you were married, when they passed away at least 9 months, or a divorced spouse that were married 10 years, you can collect survivor benefits at 60. Don't touch your own, let your own increase, and then jump over to yours. So that's possibly, yeah, the only kind of trick strategy. And then the split strategy, I did a video on that last week on spouse benefits, one filing early and then the other, delaying and then catching up. So I retired at 63 because my body is worn out from years of labor as a plumber. They know there is physical labor and office worker is very unfair. Yeah, the politicians that have easy jobs sitting around talking about increasing the full retirement age. It's already 67. But yeah, my dad was a long distance truck driver. My mom worked at the waitress in a breakfast diner, and yeah, you can't do that till you're 70 years old, plumber and all the rest of it. So I completely disagree with them increasing. All right, can you explain RSDI to me? I was turned down for disability, waited 4 years. Does this mean I'm disabled? My docs say I am, bone to bone, should I reply? It's been a while. I'm collecting 62. All right, yeah, RSDI is just Retirement Survivors Disability Insurance. It's actually, OSDI, that's Old Age Survivors. And so, yeah, it's just an acronym that Social Security uses. So that's different from SSI, which is the welfare-based benefit. So you were turned down for disability, waited 4 years. Okay, so you filed for disability, waited for 4 years, and you were still denied for disability benefits. So now you're collecting at 62. You're just collecting regular retirement benefits. So yeah, if you still believe you're disabled, then you can absolutely file for disability again. Again, watch my videos on filing for disability and some tips, tricks, and secrets in there. Janelle, I could use some help. Yeah, let us know what you need. Well, what's your question? Um, Wendy, I have been approved for SSDI starting February 2022. Why do I have to wait until August start date for part A and B? I thought they would start at 24 months. Probably there's a 5-month waiting period. Did they actually start? Yeah, so you're looking, so there's a 5-month waiting period. So that's up until July of 2024. And then the 25th month, you start your Medicare. Yes. So that's when the 5-month waiting period. Everybody has to wait 5 months. They get nothing for the first 5 months. So, which is, it's tough because, it takes Social Security, 6 months, 9 months to decide. And then once they finally decide, you got to, you get the 5 months where you don't get benefits. And one of the biggest things I have an issue with is why the 24 months? If you're on disability, that means kind of you have a disability and disabilities need medical care. And I have no idea why they make you wait 24 months. If you get a disability, I think you should get, I think you should get Medicare immediately. But yeah, once I become the enlightened dictator of America, I will make that change right after the cure for male pattern baldness. Bill, federal retired at 64. Okay, all right. Wendy, thank you for information. You're welcome. Gloria, hello. I'm on SSDI at 56 because became widow in 2022. Will my benefits be transferred to widow benefits and will they be reduced? Yeah, it really depends on the benefit amount. So if you're receiving SSDI disability benefits, are you receiving disability benefits on your own record, or are you receiving disabled widows benefits? If you're receiving disabled widow benefits, that's 71.5% of your spouse's primary insurance amount. And unfortunately, that will never change. So, yeah. So that will be the amount there. All right. All right, let's see. More questions on TikTok, and we're over an hour here. So let me do a couple more questions, answer a couple more questions, and then we'll call it a day. Doctor said uncle was not mentally capable of handling receipt of Social Security check. Does he have to have? I can already tell you what the rest is. A representative payee. Okay, so yeah. If the doctor says it, the Social Security Administration usually, abides by, the doctor's determination that the person needs a representative payee to take care of their benefits. But if there's someone there that can take care of the benefits, it's awesome. Sometimes states and counties or cities have representative payee programs. Well, they will take care of, that, but a lot of those are going away. So if you're able to be the representative payee and looking out for the person, then that's awesome. But this is why I'm kind of hesitating here is Social Security. If there's nobody to be the representative payee, then there's nobody to be the representative payee. Then yeah, the person can get their own benefits. And you know, unfortunately, sometimes when that happens, then things aren't taken care of, and they lose the money. And I recounted a story yesterday about that in my office. Yeah. Um, that we tried everything to get her kids to be the representative pay, but nobody wanted anything to do with her because she was interesting. So, but yeah, um, they can't force you. They can hold back. Like usually, what they do is they can hold back like one check until they get a representative payee. And if nobody come forth to be the representative payee, then they have to release the check. And the problem is Social Security Administration employees often don't recognize that, or they don't catch it. So, after a month or whatever, one check being withheld, so hey, nobody wants to be the payee. So you have to give benefit. No, we don't. It said you had to get a payee. No, no, no. Look at the policy. Look at the policy, and then yeah, so they'll release it. So, all right, I think that'll do it for today. If you had any questions I didn't get to, I apologize. Will be here tomorrow, a little bit earlier tomorrow. I do Thursdays at 4 o'clock West Coast time. And make sure you subscribe, share, and all that kind of good stuff. Let's find money for people out there that need it. All right.